Thank you so much, Sarah. Hi, good afternoon, everyone. My name is Heidi Illingworth. I use the pronouns she, her, and elle, and I'm the executive director at Ottawa Victim Services. I am grateful for the chance to be here today. I'm coming to you from my home office in Kemptville, which is a little bit south of Ottawa and on the unceded traditional territory of the Algonquin and Anishinaabe people. So I want to get started today talking about safe relationships and getting help. I'm going to advance my slide here. So healthy and safe relationships are really important in our life. And hopefully you have a partner in your life that and a relationship that involves honesty and respect and trust and mutual support and nonviolence. And so in our personal relationships with our family members and with our partners, especially with our partners though, so, who we're living with, we're in a relationship, we could be common law, we could be married, but we're hoping that these relationships are based on equality and economic partnership, that there is shared responsibility for raising the children and for if there are any children, and for responsibilities, chores around the home and taking care of the home, whether it's cooking, cleaning, that again, there is no threatening behavior going on, that if there should be a conflict or an argument or a disagreement in a healthy and safe relationship, the partners would discuss the problem together, and they would negotiate and be fair with each other, and there would never be any coercion or threats used. And certainly there would be no violence in such a relationship. So sometimes, though, you may notice that you have a friend or you have a family member, and you may be concerned that they are not in a safe or healthy relationship. And sometimes even we ourselves may find ourselves in a relationship that's not that healthy, but it can be very hard to recognize it when you're living in it. And so today, that's what I want to talk about a little bit with you, is that the home is not always a safe place. And we've certainly seen this during the pandemic, during COVID-19 and the lockdowns that have happened all across the world. But here in Canada, and especially here in Ottawa, we have learned that home is not necessarily a safe place. And the additional stress that came about during the pandemic, when there was financial stress on people, some folks lost their jobs due to businesses closing, the pressure of everyone being at home together, all the children being at home trying to do schooling, it meant that there was a lot more stress on relationships. And this in turn led to a lot more people coming forward and saying that they were experiencing violence and abuse at different points during the pandemic. And so what this can look like today, I wanted to talk a little bit about how to recognize abuse and violence, because like I said, it can be difficult to understand that this is happening when you're living it, or even when you have a friend or a family member who's living it. And so we wanted to share some some signals today that you can look out for, and try to recognize so that you can seek help, or you can help someone that you know to seek help if they need to. So sometimes when it comes to abuse, it is not necessarily physical violence, but yes, sometimes there is physical violence. So that can be in the form of hitting, slapping, punching, strangulation, physical force of one partner on the other. But many times there is emotional or verbal abuse that can happen. And those are situations where one partner would insult the other, use shouting, become very angry, or try to convince their partner that they are maybe going crazy. We call that gaslighting, where one partner is telling the other that they don't believe them, that something didn't really happen, that there may be a situation where a partner expresses, "I don't like the way that you have treated me," and the other partner would deny that and say, "You're making that up. That's not true. That never happened." We also see a lot of financial abuse, and that can mean things like a partner withholding money from the other, one partner being in total control of the finances, giving their partner only a very small allowance, or only allowing them to have money to buy groceries, for example. There can be in relationships that are not safe and healthy, there can be religious or ritual abuse, which means or what can look like one partner forcing the other partner to have a certain religion, or to keep a certain faith, and not letting them choose how they wish to worship. Sometimes there is sexual violence, where one partner forces the other into sexual intercourse. Any touching that is unwanted is sexual violence. In some circumstances, the children are used in situations against one parent. The partner may threaten to take them away, to call Children's Aid Society, to report the other partner as a bad parent. So sexist violence is also something that we come across, where one partner may be told that they have to have a certain role in the relationship, where they're responsible, for example, for the cooking, the cleaning, the care of the children. They're not allowed to have a job outside of the home, that sort of control as well. So all of these are examples to be aware of, where someone may be in fact experiencing abuse and violence in their relationship. And oftentimes we like to remind folks that these sort of relationships that are unsafe or unhealthy really involve one partner having to control, or having a feeling of power over the other. And so this happens, and it's usually a pattern of behavior that happens. So it can be physical assault and violence, but it often includes coercive behaviors. So those are the sort of behaviors that people use to control their partner and get them to behave the way that they want them to, that they think is necessary. And so this can happen in same-sex relationships or heterosexual relationships, and sometimes can happen within family relationships as well. So usually one partner has far less power and control than the other. And the partner who is doing the coercive behavior really tries to intimidate the other, to make the other person feel small. They use hurtful words and behaviors, and they're controlling of every aspect of the relationship. So physically, emotionally, financially, they're not letting their partner be independent and free. They really try to isolate the partner and keep total control over them and their whereabouts and their friendships, and their, even preventing people from seeing their family members because they don't want the partner to get help and escape the violence that they may be living. So, like I said at the beginning, it can be really hard to identify or to understand or to recognize when you are living in this situation, or if you have even a family member or a friend who is living in this situation, and you may suspect something is not right, but it can be hard to talk to your friend or your family member about this. But these are some things that happen that can help you maybe identify what is happening. So if your partner calls you names or insults you or puts you down often, the partner may prevent you from going to work or discourages you from going outside of the home to see your family or friends, to connect with people who support you. In some cases, the partner will try to control how you spend money, or they will limit the money that you can have, even if you are working or your friend or family member is working. They are taking your money and controlling it. They perhaps might control where you're allowed to go outside of the home, even what medicine that you can take or not take. For example, birth control, or what you might be wearing when you go out into public. A lot of times, the partner will act as if they own you. They're very possessive of you. They're jealous. They want to keep you all to themselves, and may accuse you of being unfaithful to them. Sometimes the partner may be using substances like alcohol or drugs, and they can get very angry when they're using substances. In certain situations, the partner may prevent you from seeing a healthcare provider like your doctor, or going to see a counselor for mental health support. In many situations, there can be threats of violence, or the person will let you know that they have access to a weapon like a gun or to a knife or something like that, to cause you to fear for your safety. They will let you know that they have something that they could cause you violence or serious harm with. Physically, people report that they've been hit, that they're kicked or shoved, slapped, choked. And a lot of times there can be threats made against you physically, your children, or your pets as well, or even physical harm to your children or pets. Sometimes partners will force you to have sex or to engage in sexual acts against your will. If you do not want to do that, if you say no to sexual activity, then that is being forced, and that is sexual assault. Partners in these situations will often blame the person that they are being violent towards, saying that you caused them to get very angry and you caused them to be violent, or that you deserve it. Your behavior, you did something wrong and you deserved the violence and the abuse that happened. Another warning sign to be mindful of is where a partner will threaten to tell your friends or your family or your colleagues or community members about your sexual orientation or your gender identity if you have not come out and told others about that yet. That can be a threat that's held over you. You know, if you're not heterosexual, if you're from the LGBTQ community. So these are some, you know, possible signs of abuse and violence to look out for, whether in your own relationship or whether you're here and listening because you're concerned about a friend or a family member. And so we know that in Canada, it is very common to have violence happening in the home. And we call this domestic violence. And it can happen in any family situation. It happens to, it affects people from all ethnic backgrounds. We know that it can happen to people from lower socioeconomic status, so people who don't have a lot of money or wealth, and it also happens in families where there is a lot of wealth and riches. So in highly educated and in families where there's low education levels as well. We have some numbers from 2015 that show over 92,000 Canadians were victims of intimate partner violence. And so that's domestic violence where there's violence between partners. That was reported to the police. So many thousands of people are hurt every year. Most of them don't come forward to the police. And so that's why I'm also here today, is to talk to you about my agency, because we can help you and we can help your friends and your family members, even if you don't want to go to the police. We know that women in Canada are much more likely to experience violence from their partner than men. And we also know that young women are particularly at risk. Young female adults are more at risk of experiencing intimate partner homicide. So that is where the partner kills his female partner in a violent relationship. And so in our society, we have a lot of myths that people still believe about violence and abuse. And so I want to share some of those with you today so you can recognize that these myths are untrue, and to help you to recognize that maybe you do need to get some help, that maybe you do need to get some support if you have experienced any of the warning signs that I talked about. So sometimes you'll hear people say that domestic violence or intimate partner violence is because it happens because someone lost their temper. And this is simply not true. We know that violence and abuse is always a choice that someone makes. They choose to respond this way when they're angry, when they're upset, and it's totally within someone's control not to respond with violence. So losing your temper is not an excuse to harm your partner. Sometimes we hear that, oh, well, it doesn't happen very often. He's not violent with me very much. It only happens once in a while. So it's not very serious. That is true. That is untrue as well. Any instances where there is physical violence, where there's emotional, sexual, verbal abuse, these are very serious situations. Another myth that we will hear is that someone is violent because they drink alcohol or because they use substances, and this is why they're violent, and that's not true. Substance use doesn't cause violence. Again, it's always a choice to respond this way. Intimate partner violence is only physical abuse, and that is not true. Like I said earlier, we know that emotional abuse, psychological abuse, financial abuse, coercion, threats that cause people to be fearful, these are all part of intimate partner violence and are very serious. And so there's these myths around having to experience physical force against you, or sexual violence against you. Those are one part of the problem that can happen, but it's certainly, there's a much bigger range of activities and impacts that can happen in relationships that are unsafe. If the abuser is sorry and says that they're going to never do it again, that this is going to stop, the abuse will stop. And we know that this is actually part of a cycle that happens. So there is a cycle of violence that happens where an abuser says, I'm so sorry, I'm never going to do that again. And then it will stop for a little period of time, but it is likely to restart again. So it's important to, if you have a friend or a family member, or yourself, if you're experiencing this, to recognize that there is a clear cycle that happens where the abuse stops and starts again, and it is a pattern, like I said. And the last myth that's really important to think about is that where the person who is hurt gets blamed for what has happened to them. So sometimes we hear that it's the victim who has a certain type of personality, and the victim is a difficult person. And they're the ones who seek out these relationships, and they encourage abuse from their partner because they're a difficult person. So this is a myth, and nobody deserves to be blamed for violence. Not ever. It is the person who uses violent behavior who has to be held accountable for that, and never their victim. So I just wanted to show you all the cycle of violence that I referenced on the previous slide. We know certainly that not all relationships are going to follow the exact same pattern, but there is, from all the work over the years done with survivors who have experienced abuse and violence, there are some stages that are clearly recognized. So the honeymoon stage is where things are great between partners, is very happy, it's loving, things are going really well between partners, but then there seems to be some tension building up. Somebody is getting more angry at their partner. The partner feels, often the woman feels that something is building. She may be becoming fearful that something is going to happen. And then we see the blow up stage where there is a physical assault, where there is violence, where someone is harmed physically, or perhaps there's threats that have been made. There's an incident that happens that's very serious. And then afterwards, there's that apology. There is that, I'm so sorry that I hurt you. I'm never going to do that again. And it leads back to that honeymoon stage where everything is okay again. He's promised that he's not going to do that again or hurt her in the same way that he did previously. And this cycle, like I said, repeats itself over and over. If you talk to people who have lived through this sort of relationship, it is a pattern that happens again and again. And so it's important to recognize it and to help your friends and family to recognize it if it's not you who's living it. And so a lot of people ask, and you hear this all the time, why would anybody stay in a relationship or stay in a marriage or stay in a partnership where there is abuse or where there is violence happening? Why don't they just leave? Why is it so hard to leave? And this is a question that puts the blame again on the person who's experiencing the violence, that it's on them. It should be easy to just leave. But we know that there's many reasons, many reasons why people stay with their partners, even though there may be abuse and violence. And love is a huge part of that. You're with your partner because you love them and you are loyal to them, and you don't want there to be any violence in your relationship, but at the same time you fear, perhaps you have guilt perhaps about trying to get support or going to the police. You don't want that person that you love to get in trouble, to get arrested, to go to jail. There's a lot of shame in coming forward sometimes because of what you've experienced. You don't want to tell anyone about what has happened within your home, or what is happening within your home. Victims can feel a lot of embarrassment. They can feel hopelessness. They don't know how to ask for help. They don't know who to ask for help. A lot of survivors, when they come forward or when they tell family, they get blamed. Like I said, we tend to put the blame on the person who has been hurt instead of the person who is doing the hurting. Many times people don't know where to go to get help and support. They don't know how to reach out or who to reach out, or they're fearful of going to the police. For a lot of community members who are maybe newcomers to Canada, who have immigrated here, they may not trust our police services because of previous experiences that they've had with police, and that's totally understandable. Many people stay with a partner because they're financially dependent on them. If you've been isolated or if you've not been able to work, if your finances have been withheld from you, you don't have access to savings to be able to leave. Some people stay with their partner because they think that they can help them. They think that they can help them get better, that together that they will overcome the violence or the abuse. that they can make a difference to that person's life. They can help to rescue them, help to stop the violence. But oftentimes that's really hard to do, you know, as the victim in that situation. And in other relationships, people stay because of the children. They don't want to take their children away from the partner. So there's a lot of really complex reasons why people might stay in an abusive relationship. And it's important to listen to your family or friend who comes forward to tell you about what they're going through, and to not blame them for what has happened if they do come to you. And the same for when if you're the person who's being victimized and you decide that you want to get help, that it's really important to come to a service provider who's going to support you and help you to get to safety, to get safe housing, and to get established and independent on your own, if that's what you wish to do. And so agencies like mine at Ottawa Victim Services, that's what we do every day, is we talk to women and gender diverse people about their safety and how we can help them to gain more safety and to get free from violence and abuse that they are living. Because we're talking today and doing a presentation for Ottawa Public Health, it's really important that we talk about all of the impacts that violence and abuse can have on people who experience it. And so there are serious mental health impacts from violence. We know this. We know that people can develop a very low self-esteem. They can question themselves and their sense of belonging in the world. They can experience an extreme amount of stress and anxiety. And then sometimes incidents are so severe that they will develop post-traumatic stress disorder, which leads to a lot of re-experiencing these events, an inability to sleep, nightmares. In extreme circumstances, people will feel suicidal because of what is happening to them. Physically, you could have bruises, scars from the violence, broken bones, chronic fatigue. You know, sometimes people are unable to eat properly and keep meals digested. There can be menstrual cycle or fertility issues that result because of all of the stress, and then physical violence as well on your system. We know that there are financial consequences to violence, serious. Sometimes people are injured and they can't go to work, and this means that their employment may be impacted. We know that people are isolated from their family and support network, and this can also have really serious impacts on mental health and emotional well-being. And then children who are in the home and maybe witnessing this violence, it is very serious on them. And oftentimes we will see that they may be having trouble in school, and maybe having trouble forming relationships with friends, and they may be acting out in different ways because of what they're seeing at home, what they're experiencing at home in terms of what might be happening to their mom or to their dad or to their parents in that unhealthy relationship. And so I'm here today to let everyone know that there is no reason that anyone should use violence or abuse in their relationships. Love shouldn't hurt, and we have to understand that this is something that is common in our community, and when someone is experiencing violence or abuse, they shouldn't feel any stigma or any shame in coming forward and getting help. We want to make sure that people are safe and well in their homes and in their communities. And so we want to encourage people to come forward and get help and let them know that there are support services that are confidential, that will help them to get to safety, to get safe housing, and to rebuild their lives free from violence if they choose to do that, and when they're ready to do that. That there are agencies like mine that can support any survivor to do that. And so at my office at Ottawa Victim Services, we have a number of programs that can help people who have experienced abuse or violence. And that includes we have an incredible group of volunteers, and we help victims who want to go to the police station and make a police report. We can be there with them. We accompany them to do that. That means we transport them to the police station. We sit there with them, help them. We wait for them to do that and take them back home again. We can go to court with people and support them through that process. We can provide transportation at different points in time. We have volunteers who will drop off grocery and food vouchers to people who are in need. We have programs to help with safety planning, which are really critical when someone is thinking about leaving, or they have left and they're going to emergency shelter. We do a lot of safety planning with the folks who need it, with the victims who need it. We make referrals to other agencies. We advocate for housing. We can provide 911 emergency cell phones to survivors if they have left and they don't have their phone, or a partner has destroyed their phone, for example, in a fight, or something has happened to their phone. We also have financial assistance. We have emergency financial assistance that can help victims. The province of Ontario provides some emergency funding for counseling sessions. So 10 sessions of counseling. We provide emergency home repairs, so we can do lock changes for people on their house, on their apartments, if they need to change the locks to feel safe. We have emergency childcare funding. We have emergency transportation funding. We can get people into hotels and into emergency shelters and provide some basic needs funding and meal funding as well. And then if there are serious injuries that happen to anyone during an incident, we can provide financial assistance for those emergency situations as well. There are a number of other programs across the city of Ottawa where you can get help. And my service, my agency can help to get you connected to these other programs in case you aren't aware of them. But we have a number of shelters that are 24/7 that are for women and children. So they're violence against women shelters that people can go to if they need to get out of their house and escape from the violence. We have homeless shelters as well in Ottawa. There are Indigenous and religious-based shelters, and the City of Ottawa also provides some emergency sheltering programs. There are community health centers that you may not be aware of that have programs to help specifically with violence against women. So they have walk-in programs where you can go and see a counselor. The Eastern Ottawa Resource Center and the Western Ottawa Resource Center have specialized workers to help. We have a number of counseling and family assistance centers as well. So there's the Jewish Family Services, Counseling Family Services, and Family Services of Ottawa that all will provide mental health supports to people who are experiencing violence and abuse. There are a number of legal programs as well. So some of the health centers have family court support workers if people are going to through family court and need help. There's a number of legal aid programs and legal information centers as well. And then the Victim Witness Assistance Program at the courthouse in Ottawa. If there has been criminal charges in a case and it is going through the justice system, there's workers to help support victims through that process. There's a number of housing programs as well to help get people transitioned into safe housing when there is they have experienced violence. So my team can help connect survivors with all of these transitional and housing programs that exist in Ottawa. And there's a number of other agencies as well that we work closely with. OCISO, Ottawa Community Immigrant Services, IWSO, the Immigrant Women's Services of Ottawa. There's a number of Indigenous centers as well that we work closely with, and then faith-based centers as well, like the Islam Care Center and others that we can connect folks to if they want to be in touch with services that understand their background and culture, and they're looking for those sort of cultural supports. There's a number of programs as well that will help youth in Ottawa, young people. So the Children's Aid Society, Youth Services Bureau, Children's Hospital of Eastern Ontario, Crossroads. These programs will offer counseling for young people. So depending on the age of children that you may have in the home and you want to get help for them, we can help to get counseling support for the children as well. If your friends or family member, if you yourself are LGBTQ+, we can get you connected to some of the services like Kind Space, the Two Spirit program, inclusion, Max. And then there's a number of addiction centers as well, through Sandy Hill, Rita Wood, Amethyst Women's, LECAP. So my agency is very well connected to all of the other programs, and we make a lot of referrals and work closely with other agencies to get victims the support that they need in the aftermath of violence. And like I said, you don't have to report to the police. You can come to our office and we will help you, and we will keep everything confidential, and you don't have to ever worry that we are going to involve the police. That is not something that we do at our center, unless that is what the victim wants, that they ask us to support them to do that, then we can assist if that is their wish and that is their choice. Ottawa Public Health has a web page that I would encourage you to visit as well. a whole bunch of links around getting help across the city of Ottawa. So there's a number of resources there to help when it comes to the issue of violence and to help prevent violence. So hopefully this presentation will be shared and you can click on the link and look at all of those resources. And that brings me to the end of the presentation.